Good morning, I'm Sue Perez, your host of Joy in Our Town. Well, this morning we're going to be talking about how your teeth can tell you a lot about your health. And then in the second part of our show this morning, we're going to talk about children and mercury fillings. But to get into this subject matter, we have here today Dr. Alireza Panahpour. And join me in welcoming him. Doctor, thank you so much for being here with us.
Thank you so much for having me.
You gave me permission to call you Dr. Pana.
Please.
So I don't have to say that again.
No.
Okay, thank you so much. Well, it's exciting to learn that our teeth can tell us about our health. And so you talk about something called systemic dentistry.
Yes, ma'am.
Can you define that for us, sir?
Absolutely. Systemic dentistry is more of a new era of dentistry.
Okay.
Where we pay much more attention to the diseases of the oral cavity, hard tissue, soft tissue, teeth, bone, and the gums. Much closer attention, and the close association of these diseases to the rest of the body.
Okay.
There's a lot of information now, a lot of research on chronic inflammation, how it's basically the culprit, the common denominator to a lot of our other illnesses, anywhere from diabetes to GI issues to even cancer. So as a dentist, I take the responsibility of always making sure that I'm able to help my patients on all those different levels.
All right. Could you give us some specific examples of how one's tied into the other?
Absolutely. Let's say I have a patient that comes to me every 3 months for a cleaning because they seem to accumulate more black bacteria than others. I like to step back and get some more information. What is their blood type? What is their diet like? Basically, be kind of curious and try to figure out and help them figure out what is going on. Most cases is always a hormonal issue with women. I think every woman that's gone through pregnancy knows when they get pregnant, the surge of hormones, the gums bleed, the gums get swelled up, the body accumulates more plaque. So we know that gum issues are very hormonal.
Okay.
So by stepping back, referring to the right medical doctor who's also up to date with the research, we're able to take care of the common denominator.
And let's talk about inflammation, let's say.
Inflammation.
What would inflammation be an indicator of?
I think the last survey was 90% of the American public have some sort of a gum disease. Gum disease is a chronic inflammation. This gum disease could be to, well, lack of dental care. It could be also due to high rate of plaque formation around the gums. The body cannot get rid of it, so the whole gums goes into an inflammatory mode. So once the gum is in inflammation, that means the whole body is under inflammation. And we know that chronic inflammation keeps your body in more of a, what we call a sympathetic dominance, fight and flight. Fight, 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 fight. That puts stress on the thyroid.
Would we call that like a stress of some sort?
Is the stress the body's going through because of that chronic issue.
Okay.
So that starts affecting your thyroid, your adrenals, organs, liver, so forth and so on. So again, it's stepping back, trying to look at the whole picture, not just be, okay, well, there's your cleaning, thank you so much, see you in 3 months. I don't believe in that. I believe in more of a preventive measures of therapy.
Now, I am a proponent of regular dental visits. I have not heard of this term systemic dentistry. How new is it? Am I just way behind, or?
No. Well,
and how is it being received?
Well, dental health, you know, in the 1800s and early 1900s, it was very focused on the overall health.
Okay.
Unfortunately, through years, you know, different reasons, dentistry has become just like the way you look at a corner and you can see a McDonald's, you know, these like 3 different types of fast food chains. This is kind of what dentistry has become. You look at any corner, you have like 3 different dental offices that are going on. So, and it's unfortunately it's become more of a drill it, fill it, bill it type of. But you know, I didn't go to school for that. I went to school to be able to help my patient on all different levels.
Okay.
It requires a lot of research, a lot of continuous education, but that's why I'm there.
Now, this seems to me, just from my observation, that you've gone above and beyond the call of duty here from what, in my mind, is a typical dentist. So how is it being received in that? Are people responding like, you know, I'll leave that to my doctor, or are they saying, oh, you know, cooperating with it?
Thank God for the internet.
Okay.
These days, more and more individuals are doing their research before any type of intervention, anywhere from, you know, buying a car to going to your doctor. And I always want my patients to do their research. So more and more patients are coming to us asking their doctors, how about nutrition? How about this? I'm taking echinacea, I'm taking garlic. How is this helping? So what I've learned more from my patients than any courses I've taken.
Okay, interesting.
So, and I never want to be kind of dumbfounded.
Yeah.
So being involved with all this new research that is coming out and that's available to us by looking for it. You know, my grandfather used to say, the eyes cannot see what the mind doesn't know.
That's good.
So if you learn it, you know it.
Yeah. Now, how does this play with the insurance industry, in that are you limited as to what level or extent of recommendations you can make as a dentist?
No, I use all the same codes that has been provided me by the American Dental Association. I don't do, there are few therapies out there that the insurance doesn't cover, and the patient has a choice of doing it or not doing it. But the future of insurance, Scientific America, I'm sure you're familiar with the magazine, a few months ago had a fantastic article on dentistry and medicine. The future of insurance is medical dental will be combined together.
All right, so they're seeing that. In other words, it's coming full circle.
Absolutely, absolutely, because more and more our countries are shifting to that type of a paradigm.
Do you feel with what you're doing now, do you feel that then it's easier for a dentist who has limited himself to just I think you said drill it, fill it, and bill it. Is it easier to just kind of resort to that then and not take on?
I think it's more individual based. Every one of us is so different. For me, again, it's always been curiosity. I'm a very curious individual, and my relationship with my patients goes above and beyond. You know, I actually look at my patients in the face, in the eyes. You know, I look at their posture. I know who they are.
Okay.
It's all about priorities in life. I think it's not what you have, is what you do with it.
Okay, good.
I was given the title of Doctor of Dental Surgery, and I take that very seriously.
Now, do you work directly in conjunction with the medical doctor then?
Absolutely. I'm fortunate enough